Hello everyone, I'm Dr. Rose Cheng. I'm a perinatologist and I deal with high-risk pregnancy women.
Hi everyone, I am Dr. Sarapuddin. I am a neonatologist and I take care of babies delivered prematurely.
Okay. Most of the time in the clinic, we do get a lot of questions and cases about preterm birth, which is why today we're going to be
Debunking Prematurity Myths.
Is eating pineapple and cream cheese, can it cause preterm labor? Okay.
Makes me hungry.
So that is a myth. Most of the time, I also get these questions. Specifically, a pregnant patient will ask, are there particular food groups that I'm not supposed to eat? So let's just custom tailor it to this question. Pineapple is definitely safe, but there have been some literature mentioning that pineapple contains bromelain. It's an enzyme that supposedly a few studies have said that it softens the cervix and then trigger preterm labor. But it has already been disputed and it has been validated that for that bromelain enzyme from the pineapple to cause preterm labor, you have to eat 7 to 8 pineapples or more in one sitting.
That's a lot of
so
pineapple.
Who eats that? And then cream cheese. Cream cheese is pasteurized milk. And it is a spread. Most of the time, when it's just that, it's pasteurized, it will not cause preterm labor at all. But you're supposed to avoid the unpasteurized milk. And that's your the mold type of cheese. You have your brie, you have your camembert, I forgot the name of the other one, chèvre. So those are the cheeses or the types of cheese that a pregnant woman should avoid because they have shown that if it's unpasteurized, sometimes it can cause preterm delivery. So, does all preemies have developmental delay source?
I wouldn't say that babies born prematurely have developmental delays. Rather, they are at risk of developing minor and major cognitive delays, cerebral palsy, visual, motor delays, psychosocial problems, behavioral problems. And we also have to note that the more premature your baby, the smaller they are, the higher their risk of developing all these neurodevelopmental sequelae. And we also have to consider that their course in the NICU plays a major role. How long have they been on the ventilator? Do they have bleed in the brain? Do they have severe infection? So those are the things that we also have to consider. We have babies who are born prematurely like 24, 26 weeks, and yet they're professionals now. So I wouldn't say that they have developmental delays. So a lot of factors plays a role.
Must have had a great neonatal ICU care for them. Okay, thanks for that source. The next one, I think it's mine. It's the mother's fault. Failure of mother to protect the pregnancy. Okay, again, a very commonly asked question. Sometimes when we get these cases and they feel so bad that they are in preterm labor and the prognosis is likely very dim, meaning they're going to really deliver a premature baby, they always try to blame themselves because they find a reason why it happened. So this is a myth. Preterm labor has been an illness that has been in existence for so many years, but the sad fact is nobody knows the sole cause, which means hindi siya dekahon. There are a lot of preterm delivery cases or preterm birth cases wherein it can be caused by infection, it can be caused by sexual activity, or it can be caused by things that are actually innate in the pregnancy. If it's a multiple gestation, if the mother is carrying twins, triplets, then the uterine distension is going to cause the preterm labor. If there are placental abnormalities down the line, there are a lot of things that can cause it. So for the mother to actually blame herself, it's not good. Most of the time, even the ones who have taken care of themselves so far and those who have very, very low risk histories, sometimes it just happens. So the mother should not blame herself. This is Dr. Rose Cheng.
And this is Dr. Sarapuddin.
We are from the Medical City, taking care of you.